First of all, thank you very much for the organizing committee of the APACPH 2020. I'm glad to be here and share one of our research with all of you. The research title is Health Literacy, Fear of the COVID-19 and Health-Related Behavior amongst the undergraduate medical students. And we conducted this one in 8 universities in Vietnam with so many co-authors. As you know that during the COVID-19 pandemic, the myths and the misinformation largely concern the public. This may affect the public's psychology health, and people with the higher education and also level of the health literacy are likely to have better perception of the health informations. And in previous study, we showed that health literacy can protect people's mental health. And during the pandemic, the rearrangement of the healthcare personnel and change in how medical students are encouraged to respond to the COVID-19, and medical students still, taking the clinical practicum, so this may, push them at risk. And moreover, medical student mental health already been demonstrated as a problem worldwide, including Vietnam, even before the pandemic. So during the pandemic, it would be the problem. So there's a fear of the COVID-19. There's a scale to develop that, and we use 2 measures in our study. Fear of COVID-19 caused the healthcare access delay and even suicide. So to mitigate and contain the pandemics, it's important to detect the psychological problems such as fear, and implement appropriate intervention at the early stage in their occurrence. And that's why we conduct this study to examine the association between health literacy and also fear of the COVID-19 and health-related behavior amongst the medical student. And we conducted this one in 8 universities in Vietnam with a total sample size of 5,423. And we measure health literacy, fear of the COVID-19, health-related behavior, and also many other social factors. So we found that there's several number of predictor of fear of the COVID-19, but one we would like to mention is about health literacy. So health literacy, after adjusted for many other factors, is associated with lower fear, right? It's, we reduce fear in the medical student. And when people have fear, they're more likely to smoke and also drink. So this is the bad behavior during the COVID-19. So in conclusion, the factors such as age and last academic years, later academic years, being male, a greater ability to pay for medication, and a higher decrease of health literacy may protect the medical student from fear during the pandemic. And people who have a greater or higher score of fear more likely had unhealthy lifestyle, such as smoking and drinking alcohol. So we suggest that strategic public health intervention are suggested to reduce fear and also promote a healthy lifestyle, which may further protect student health and well-being, and also contribute to contain the COVID-19 pandemic. So with that, thank you very much again for having me in the conference. Thank you.